So hello, and you're very welcome to this first podcast in a series that I'm doing, which focuses on occupational therapy and autism. My name is Conor McDonough. I'm an occupational therapist and an advanced sensory integration practitioner. I'm the owner and director of Aucupational Therapies. We're based in the Midlands in the UK. We provide autism assessments for adults and children, but we also provide sensory assessments. We support people with treatment and support. We also do fairly extensive packages of training for schools, parents, etc. So for anybody who is listening to this on a podcast, I guess the message is you're really missing out. We're also putting this on YouTube. So I'm an extremely good-looking person, and effectively it could be a massive treat if you were to look at this on YouTube. So if you get the opportunity, check that out. So in this episode, I guess initially I'll tell you a little bit about myself and how and why I got into occupational therapy. I'm going to explain exactly what occupational therapy is, and then we'll start to explore how occupational therapy can support people with autism by going through all the potential difficulties that a person with autism will experience, and therefore maybe give you some examples of how we can support. So I qualified as an occupational therapist approximately 15 years ago. Prior to that, I studied for a degree in applied social care in Ireland and therefore worked in the care industry, supporting people with acquired brain injuries and learning disabilities, and obviously then people with autism. I had worked in care for a number of years and had started to come into touch with an awful lot of occupational therapists. And when I started to learn more about this job and the role, I felt like it was something that I would really be happy to do. So now let's maybe explain what occupational therapy is. So I guess a clue is in the name. Occupational therapists will focus on occupations. So these can be activities of daily living that we need to complete, like washing, bathing, eating meals. And an occupational therapist initially will identify where there are problems for a person to complete these activities of daily living. And therefore we start to think about interventions or strategies that we can provide for a person to help them to overcome these issues. We do identify as client-centered, so this means that we're predominantly led by the person that we're supporting. So we often pursue and develop interventions based on a person's interests. Occupational therapists work in a variety of settings. So this can include, for example, working in hospitals. And one of the areas may be supporting elderly patients who've had knee and hip operations. In this case, they may have difficulties with getting out of bed, getting from a seated position to a standing position to wash themselves at a sink, for example. In this case, we would start to think about adaptations or equipment that will help them with this transfer. So things like handrails, or simply ensuring that they have a seat that's higher and makes that transfer easier. We also obviously work in mental health. We support people with learning disabilities. So it may be, for example, that people in these situations become quite isolated and struggle with social interactions. So we can, for example, set up groups where we give people like this opportunities to meet others. It may be based on a structured activity, so where there's a lot of anxieties about meeting other people, they have the benefit of being able to focus on an activity. And of course, we work in supporting people with autism. So we're going to spend some time now explaining this in a bit more detail. So in order to meet criteria for autism, a person must have difficulties with social interactions and social communications. So this often results in difficulties with building and keeping friendships or relationships. So let's say, for example, a person with autism has delayed speech, or they still struggle with their speech. One of the issues, in my opinion, is that from a very young age, and I'm talking before 12 months, as a person is developing speech, they are starting to learn the very basic skills of how to interact with others. So how to approach other people and get their attention, how to then use words to start a conversation or start an interaction to get your needs met. And through doing this, they are also starting to learn how to reciprocate or to interact with others. So to read body language from people, to understand gestures and what they mean. And where a person has delayed speech, they can start to miss these kind of starting blocks. And therefore, I guess from my point of view, they're starting at a disadvantage. And what this means then in later life is that a person will struggle to use these very basic skills. Therefore, many social interactions will be problematic, and this can obviously create high levels of anxiety and trepidation, really, when it comes to interacting with other people. So as an occupational therapist, I guess we are looking at the very basic kind of social and communication skills that we use. It may be identifying where there is a lack of these, exploring why this is, before we can then start to educate people with autism and their parents or carers about these kinds of difficulties. We'll then start to think about interventions or types of support that will give them the opportunity to learn these skills and to practice them. So we may, for example, set up groups where a person is given the opportunity to practice and to use these skills. We may support a person on a one-to-one basis, or we may simply spend a lot of time educating parents and carers on how to support them. As people get older and they turn into adults, we can start to look at opportunities for people with autism to access support groups or other opportunities where they're meeting like-minded people. And we can also support them with developing and supporting kind of secondary issues around this, where a person may have developed depression and anxiety. So in this case, we may support them with a kind of graded plan where we're starting very slowly in short bursts to give them opportunities to practice these skills. And the second area that a person with autism will tend to struggle with is what we refer to as restrictive and repetitive patterns of behaviors. So these are types of behaviors that restrict a person from engaging in activities, or their behaviors that are very repetitive. So for example, a person with autism may have repetitive motor movements. So people are often aware of a person who flaps their hands or spins repetitively or just simply constantly fidgets. In this case, it's likely to be a sensory processing difficulty where a person is not receiving enough of this stimuli in their central nervous system, or the central nervous system is not processing it well enough. Therefore, their body is telling them that I want this sensation, or it's seeking this sensation. So as an occupational therapist, we start to identify where there are sensory processing difficulties, and we will then start to think about educating and providing opportunities for them to receive this type of input. And ultimately, once a person does receive this input, it helps them to feel calm and regulated. But in the short term, we may start to think about strategies that allow a person to receive this type of input in a more kind of socially acceptable way, so they don't stand out as much. A person with autism often appreciates consistency and things being the same day after day. Therefore, they can often have difficulties when there are changes to their usual routines. It makes them quite anxious and it's difficult for them to manage. Now we know people with autism are often working predominantly in the logical side of their brain, because it may be that they haven't developed connections between the logical side of the brain and the creative side of the brain. The creative side of the brain is important because it gives us ideas to do things differently. So if I have a particular routine where I get up in the morning, I have a shower, then I brush my teeth, then I have my breakfast. But I get up on this particular morning and there's somebody in the shower. The creative side of my brain is giving me the idea to firstly have my breakfast and then have a shower afterwards. And then I can get out in time. But if I'm predominantly working in the logical side of my brain, I can't see an alternative. Therefore, I get quite stuck in it and it makes me quite anxious and unsettled if I can't perform my routine as I usually do. So as occupational therapists, we will do a number of things to support a person with autism in this case. Firstly, we'll start to identify some very practical strategies to help them create and manage their usual routines. So it may be, for example, that they are quite distractible and they struggle to focus and to concentrate, or they are very disorganized. And in this case, we usually support people by recommending a variety of different types of apps that are very useful to help people to organize their schedules. We can recommend some visual reminders like timetables, or even watches with alarms or that vibrate when you need to do a certain activity. But we can also support them by helping them to manage changes to their usual routines. So by providing coping strategies. And this may be, for example, that they have strategies to manage these anxieties. So it may be things like breathing techniques or opportunities to focus on their interests at these times to take their mind off the issues. But we can also help them to come up with other ideas. If this is the case and your usual routine is broken for whatever reason, what can you do about it? And finally, we can start to encourage connections between the logical side of the brain and the creative side of the brain. So we know that physical movements where you encourage a person to cross the midline. So the midline goes from the top of my head right down through the middle of my body. So if I move my hand from right to left or vice versa, this is crossing the midline, but it's also sending connections between the logical side of my brain and the creative side of my brain. So what we can do or recommend or support a person to do is come up with a variety of different types of games, depending on their interests, that encourage them, just for example, to throw a ball from right to left or vice versa. When a person is highly focused on a particular interest to the point where it interrupts other activities of daily living, so they become so focused on trends and reading about them and learning about them that they forget to eat, or they spend most of the time in the room doing this. We can start to support them by encouraging a more healthy routine. So they have specific times when they can focus on these activities. But I guess in the longer term, we're looking to put a very positive slant on this because, for example, they reckon there's a very high percentage of people in NASA that have got autism. And this is because when a person has an intense interest, they can often become an expert in that area. So we can often look for opportunities for a person with an intense interest to use this in a very positive way. But this area can also kind of interlap with difficulties with social interactions. Because, for example, one of the issues that we often see is where a person has an intense interest and they start to interact with other people, they find it very difficult to talk about anything else other than this intense interest. So in this case, we can start to think about providing them with kind of social scripts or ideas of other things to talk about. We can also help them to recognize, frankly, I suppose, when a person is bored in what they're talking about. And finally, a person with autism often has sensory processing difficulties. It's estimated that up to 80% of people with autism have sensory processing difficulties. Now, there are a number of different types or categories of sensory processing difficulties, and there are three main areas. The first one is a sensory modulation disorder or dysfunction, and this is when a person either over-responds or they under-respond to a stimuli. So let's say, for example, with noise, if I over-respond to noise, it means that I'm overwhelmed with specific sounds. So if you think about the child or the adult even who puts their hands to their ears and avoids, fire alarms or loud sirens, they're becoming overwhelmed with this stimuli. And we tend to see issues in a number of sensory systems. The second area is difficulties with sensory registration or discrimination issues. So a discrimination issue is when a person will struggle to tell the difference between the components of a stimuli. In other words, let's say, for example, when it comes to our tactile system and our sense of touch. Our tactile system has approximately 6 different types of receptors that give us information about a variety of things, like light touch, heavy touch, pain, temperature, etc. So if you imagine that you close your eyes and you put your hand on the top of a table, you will typically be able to tell me if the table is rough or smooth. You'll be able to tell me if it's hot or cold. If you happen to feel some crumbs, you'll be able to tell me the consistency of these crumbs. So are they easy to break down or not? And therefore you might be able to tell me that it's a piece of bread or it's some flour. And if a person has a registration issue because they struggle to determine the nature of the stimuli or what that feels like, they can often seek or avoid. In other words, they can over-respond or under-respond at different times. So this is where it may be a bit confusing for people because they're thinking, well, I know they have an issue, but sometimes they're, very sensitive to labels on their clothes, but other times they're giving me loads of hugs and seeking this kind of input. And if a person has difficulties in this area, they will have issues in all sensory systems. And the third area that we consider when it comes to sensory processing difficulties it's called a praxis issue. Many people would have heard of dyspraxia. It's the most common praxis issue. And this is predominantly a motor coordination issue. So our vestibular and proprioceptive systems give us information about balance and motion and also where our body is in space. So this will look like the person who is clumsy, they don't have great coordination, but they may also have difficulties with the fine motor skills, so things like handwriting, fastening buttons, etc. And an area that many people don't consider as much when it comes to praxis issues is the impact it has on how we process information. So this is about executive dysfunction. And executive functioning happens in our forebrain. It's right at the top of our forehead or just behind it. And this area helps us to focus and concentrate. It helps with our levels of impulsivity, and it helps with focus and concentration, amongst other areas. So if a person has difficulties in these areas, then obviously they're going to be quite distractible. They will struggle to concentrate for long periods, and they will have difficulties with problem-solving situations. So as occupational therapists, obviously we will initially identify where there are issues. We can often do pretty extensive sensory assessments where we're initially identifying the category of sensory processing difficulties that a person may fall into. Therefore, we can start to think about recommendations and support. So all of our sensory input travels through our midbrain. And I am simplifying it, but it effectively will go through one of two areas. The reticular formation is known as the fight-flight response. If this becomes overwhelmed, and this is when we can go into high arousal. So this means that we can have greater difficulties with high levels of impulsivity. we'll struggle to manage our emotions, we can become hyperfixated on issues, amongst other problems. Whereas other types of sensory stimuli will travel to an area called the thalamus, and this helps to filter sensory information. And when we receive input to this area, it helps us to feel calm. So we can start to think about a sensory diet of activities that directs information to our thalamus, and this helps us to feel calm. We can also start to think about how we can manage the environment so a person doesn't become overwhelmed with too much noise or bright lights. And we can also start to think about how to develop and strengthen muscles in our arms and our hands that will help with the big motor movements like kicking and catching, or even the fine motor skills like handwriting. But as we're coming towards the end of the first episode, I'd just like to remind people that I will be doing a number of other episodes where firstly we're going to start to focus on speech and language issues and how we as occupational therapists can support with this. We'll then go into an awful lot more detail in another episode on sensory processing difficulties and what are the kind of things that we can do to help with this. And we're also going to focus on managing strong emotions and high levels of anxiety. We're going to speak about sleeping, toileting, and eating issues with people with autism. So I hope you enjoyed the first episode, and I'd like to think I'll see you soon.